Hi, Dr. Desman here. I wanted to send you a quick video about breast implants, and you've decided to go ahead with your surgery. And in November of 2021, the FDA put out a mandate that we give you certain information regarding breast implant surgery. And this video is just a little highlight of some of the information that you need to know. So you're going to be sent a email that has a link to a breast information booklet, and that booklet is one of the things that the FDA mandates that we give to you. So you'll have an email with a link to the breast information booklet. You can download that. You can read that at your own pace. In addition, we will need to go over a patient information checklist about breast implants. And on this checklist is a lot of the information that we go over during your consultation, a lot of the information that's on our consent forms as well. But I just wanted to kind of highlight this whole new process. So we go over the information checklist. I'm going to give you the opportunity to initial the checklist in certain parts and sign the checklist. I'll sign the checklist as well, indicating that we've gone over it. We'll have that checklist available to you in your patient portal, so you can access that at any time after we've gone over that. You can download it, you can print it, you can do whatever you want with it. Now, like I said, the information on the checklist is really a lot of the stuff that we've already gone over or will go over during your appointments. One of the points of emphasis from the FDA is something that I always talk about during our consultations as well, and that is that implants are not lifetime devices, and that's just something that you do need to know. So, for example, in the future, I tell folks all implants eventually leak. And so if you have a leak, you're going to either want to replace your implants or take them out and leave them out. Another thing that may cause you to have surgery in the future is that the scar tissue that sits around the implant, which is called the capsule, can sometimes get firm and hard, and that can cause the need for further surgery. Now, each manufacturer has a separate patient information checklist that we need to go over, and there's actually a separate checklist for each different type of implant. So for example, if we choose to use a Mentor silicone implant, there's a Mentor silicone checklist. If we choose to use an ideal implant saline implant, there's an ideal implant saline checklist. Or if we use an Allergan saline implant, there's a separate Allergan saline checklist. And the reason why they have these different checklists is that each checklist has the manufacturer's specific data involved in them. So in the checklist, it goes over potential risks and complications. One of the risks of surgery that we've already discussed is the risk of a hematoma, which is a collection of blood underneath the skin. So for example, in the Allergan checklist, the risk of hematoma formation with a saline implant is 1.7%. With an ideal implant, that risk of hematoma formation is 1.8%. Because the different manufacturers have different rates of hematoma formation, they publish that separately in the individual implant manufacturer's checklist. The general information in each checklist is the same, it's just the specific data to each manufacturer is listed in each of the checklists. And we'll go over that in detail at your pre-op appointment. But I just want to kind of give you a heads up as to what we're doing as far as following the FDA regulations and why we're doing that. There shouldn't be any surprises with any of this information. It's all stuff that we're going over as part of the routine. And if you have any questions about this stuff, if you have any questions about the patient information booklet or about the checklist, don't hesitate to give us a call, 703-924-3144. Thanks a lot, and see you soon.